Today we'll be talking about substance use in with older adults and some trends, some resources, how to help individuals with whomever you're working. First, I'd like to start off with talking a little bit about what is the Drug and Alcohol Commission. The Drug and Alcohol Commission is a single county authority for Bucks County, and basically what we are the, let's say, liaison between our drug and alcohol providers, the community, our different stakeholders, and then the federal government and the county. So we receive our money. It's federal money that goes through the county to us, and then we go through intervention, prevention, and treatment. So we're the go-to agency. So if you ever have any questions or need any help, definitely please connect with us because we will definitely help you out. So I'd like to start off with, about addiction. The clinical terminology that's being used now is called a substance use disorder. And so when you're talking about a substance use disorder, it's an illness caused by a combination of behavioral, environmental, and biological factors. And what that means is, does the person have a genetic predisposition for addiction? We have the on and off. Some of us, if we take one drink and we're okay, other individuals take one drink and one drink's not enough. So there's a genetic predisposition to addiction. Environmental, nature versus nurture. Who are you raised with? What are the views in the family about addiction? Or what you're exposed to? Behavioral, what is it that you're doing, your coping skills and things like that. So it's really a combination of things. And as many of you have heard before, what's the difference? Is it, the chicken or the egg? Did the substance use come first that caused maybe the mental illness, or did somebody have mental illness and has used substance use as a coping skill? So, you don't know what's going on. With substance use disorders, like other illnesses, if it goes untreated, it does change the functioning of the brain. So somebody who's been using substances does have a chemical imbalance, does create physical and mental health issues in the brain, and it could become more severe, disabling, and life-threatening. So many people and people that we know have died because of substance use disorder. They have overdosed or have caused such physical damage to their bodies that it's caused life-threatening. And you can't talk about substance use without talking about co-occurring disorders. Co-occurring disorders are a combination of mental health and substance use. And sometimes it's, mental health, could be mental developmental disability or substance use. For this presentation, we're going to focus on mental health and substance use. So with co-occurring, somebody has a psychiatric mental health diagnoses. It could be depression, anxiety, schizoaffective, obsessive compulsive disorder, whatever, and a substance use disorder. So they are dealing with two major illnesses, and they need to be treated equally. Many times old school thinking was you have to first treat one before the other, but you really need to treat them hand in hand. It is complicated, and individuals with co-occurring disorder, many times, they need more severe treatment, they need more longer lengths of treatment, and more supports. So when learning about addiction, substance use, mental health, you're really talking about, the brain, how the brain works. And, we are all wired to make us feel better. That's how the brain is. The brain is wired to make us feel better. So we have these, what we call happy hormones that kind of maintain our mood. So, you have your dopamine, your oxytocin, your endorphins, and your serotonin. That combination kind of maintains our mood. So, it makes us happy, makes us love one another, just makes us all around feel better. And every behavior that we have, is recorded in our brain and is geared to make us feel better. So when you introduce substances into your brain, now you're causing an imbalance, and now you're increasing the dopamine in your brain. So when somebody is introducing alcohol or other drugs in their brain, you're flooding the brain with pleasure chemicals. So all of those happy hormones get released, you feel great, but then it also deprives the brain of the warning chemicals saying, you know what, you're feeling too high, let's bring you down a little bit. It creates great euphoria, inhibits the anxiety and the fear, so you're not really clear-headed, impairs your judgment and impulse control, so you're really not thinking clearly. and you hear that when people are intoxicated. And some of this is also could be seen like the high level of euphoria could also be seen somebody who has mental health, like a bipolar manic episode. So when you're looking at somebody, you're not sure what's going on, but being aware of that. So here's just a quick graph about, what releases dopamine levels. So our normal dopamine level is about 100. So, everyday life, we're feeling okay. But as you enjoy things, increases your dopamine level. So you have like great food increases dopamine level, to 150. Sex, cocaine, your prescription opiates, heroin, and methamphetamine. So when you look at, you're trying to understand why do people use, why do people crave, look at the heroin and methamphetamine dopamine levels. Methamphetamine is almost 13 times the amount of normal dopamine level, and then heroin's about 12 times. Alcohol falls between cocaine and probably prescription opiates. So when you're thinking your brain is geared to making you feel better, look at why individuals may be more attracted to methamphetamine and heroin and how addictive that is, wanting to feel better. And sometimes it's really hard for individuals to understand that because, you're thinking, I would never do drugs. I would never inject drugs. And that is a hard concept to understand. Why would people want to do that? And there's a lot of different reasons for individuals to want to use. But even if you think of yourself, like even a cookie, it increases dopamine level, caffeine, smoking, soda. So, just sometimes the anticipation of having a cookie or, having dessert increases your dopamine level. For individuals who have tattoos, the anticipation of getting a tattoo increases your dopamine level. And while you're getting your tattoo, it increases your dopamine level too. So, many times people, want more than just one tattoo. It's because your body is trained to think, okay, what makes you feel better, dopamine is increased, so now your body is remembering all that. So when you're talking about the reward system, that's where everything's stored in your brain. It's in the limbic system, and it's called the reward center. And there is a section in there, the whole area is called VTA, ventral tegmental area, and that is basically a filing cabinet. So every time that you do something that makes you feel better, it goes into that filing cabinet. So when you're feeling sad, you're feeling lonely, you're feeling, not good, your brain is saying, okay, well, I have to do something to make this person feel better. And it goes into filing what has worked before. And it could be going for a walk. It could be, reaching out to a friend, whatever those things are. So it stores the people, places, and things. So when you do something that makes you feel better, your brain is scanning the environment and it's saying, okay, what did you do? Who did you do it with? And where were you? So when you're looking at people in early recovery, they talk about changing people, places, and things. It's because your brain is wired that those people, places, and things make you feel better. So those could be your triggers to make you want to do something that makes you feel better. The other interesting thing is trauma. Trauma occurs and, it's stored in that part of the brain where individuals really don't have access to it. Like you can't rationalize trauma. Like things happen, they pop up, and then you're left with wanting, having to deal with it. So when you're looking at older adults, when you're working with older adults, many times trauma could be part of their lives. And it's important to recognize that maybe the coping skills that they've used before are no longer available to them for whatever reason. So maybe their traumatic experience is coming back, or they're in a situation now where they feel unsafe. So they may be triggered, and that might lead them to wanting to numb that feeling, numb that pain. So those are just things to always think about. So looking at the cycle of addiction. So when somebody engages in a behavior that increases dopamine, so it might be helpful if you think of something that for your own personal, like what makes you feel better, right? And I know I've done trainings before, and people may have been in those trainings, but I'm addicted to Oreos. Oreos make me feel better. But so you think about what increases your dopamine. So the first time you do that behavior, it makes you feel good. Your brain is storing that information. It's going into your VTA, your little filing cabinet. And so, but once that wears off, when your dopamine levels are low, your brain is going back into that filing cabinet and say, okay, well, this person needs to feel better. So what works for that person? So then that person will go back to what's going to increase dopamine level. So when you're talking about somebody who's been using outside substances, that dopamine level is pretty high. So that's what the body is craving, that level of dopamine, that dopamine level. So they use again, and then that use increases your dopamine level, and then you start rationalizing. Even though it's bad for you, you're still, you make all these justifications like, oh, okay, I just ate one cookie, what's so bad? Or, I just did one bag. You can just, I know cookie and heroin's two different things, but it's just a rationalization continues. And then your body, with what happens with substance use, you build a tolerance for it. And also your body could get physically addicted to some of these drugs like heroin, alcohol, benzodiazepines. So then you start using to not only feel better, but you're preventing the sickness, or you want to feel normal. So that's a cycle of addiction. And you try to teach individuals about the cycle of addiction and trying to give them coping skills so they could stop the cycle. Then if you're working with high risk, high need individuals, you're looking at, what level of are they at to seek that dopamine, that increase in dopamine. So this is just some information to kind of help and give you some background about substance use and the cycle. Because of what's going on today, it's really important to understand the implications of the situation we're in now with COVID and how it does affect with the older population. Who are you working with? So when you're looking, we're talking about the COVID situation, think about if you're working with someone, if you're, living with somebody, anything, it's really helpful to kind of understand that. So one in three older adults have symptoms of anxiety, have expressed symptoms of anxiety during during COVID, and that was up from 1 to 10. I believe this study was from March. So you see that the anxiety and depression is increasing, and all of us could relate to that. 13.3% of adults reported new or increased substance use to manage stress to the coronavirus. So we have seen that increase in the need. There may be a decrease in the bed availability, but there is an increase in need. When you're thinking about the isolation, the loneliness that's occurring with all of us, the disconnection, think of our older adults who are, if they're in a nursing home or in any kind of living, or don't have the access to family as they had before, or caregivers. These are all things to think about that can increase their mental health, can increase their need for substance or relapse into substances. So this increased depression, anxiety, stress, low self-esteem will lead to higher rates of substance use, and the suicide rate has gone up. Talked a little bit about lack of connection to family and peers. If individuals have case managers that do home visits, and now there is no connection to the case manager, has to be telephonic or anything like that. Telehealth appointments, even if the individual with an older adult, at least they're getting out to see the doctors, now the appointments are occurring through telehealth appointments. And what are the challenges for individuals to receive telehealth appointments? My mother is 78, 79 years old, and telehealth appointments don't work for her. First of all, she's hard of hearing and she's blind. So she's got a double whammy there. But the engagement for older adults to be able to talk and to hear, and if their mouths are covered, sometimes it's just that disconnection. It's really difficult. And what about misdiagnosis and undertreated, with the older adults because of the appointments? There's lack of oversight, there's lack of connection. And then on the other side, the lack of therapists and providers, are the bed availability or the need for distancing. So there's less options, less slots, because let's say a group could only hold 10 to 15 people, but now they only have 6 people because they have to maintain social distance if they're doing face-to-face. So these are just things that are that COVID's bringing on to everyone, but specifically how is it affecting older adults? So we're going to move on. And please, if you have any questions, just put in the chat box and Mandy will pick up the questions. Substance use in older adults. So many times, what's going on with our population, what's going on with them, the loneliness and things like that, and really drinking, while they're still maintaining their med compliance, but what are they doing in addition to that might be interfering with their med compliance? So when you're looking at your older adults, looking at what are they currently dealing with? What are the things that can cause an older adult depression, anxiety, wanting to use, wanting to go back to some old coping skills. And it's something important to understand, to communicate with the older population, like what's going on, have there been any changes in your life, so that they could definitely share with you, what their fears are. So when you're talking about retirement, death of a family member, spouse, pet, or close friend, loss of income or financial strains, relocation or placement into a nursing home. My mom had to sell her house 3 years ago, and that was to me, it wasn't that big of a deal, but for her it was devastating that she couldn't maintain her house and moved into an apartment. And what did all that, mean to her? Trouble sleeping, why are they having trouble sleeping? They already have lower melatonin levels, so, what's going on with there? Family conflict, what's going on with the families, and then again, their physical health, their mental health decline, really is a risk factor. So if you're working with an older adult and they just found out that they may be losing their hearing, or they're diagnosed with high blood pressure, they've never had high blood pressure before, these are things that could be, cause something in them that they're going to need outside help to make themselves feel better. So when you're looking at, what is a coping skill, or is the person you're working with, what is their coping skill? So when you're doing an interview with an older adult or working with them, find out not only what's going on currently with their life, what are their coping skills? How are they managing all that stress? How are they managing the loneliness? Because their brain is going to try and increase that dopamine regardless. And then along with that, as they continue to do things that increase dopamine, it might build a tolerance to the point where, they may need inpatient treatment. How are they socializing? Are they, able to do, connection and family visits? I mean, Zoom calls. My mom, I inherited my mom's technical skills. We can't do any Zoom or anything like that. It's really difficult for her. So, trying to teach her that or trying to stay connected could be a real challenge. So looking at the substance use prevalence in the older adults, their substance use rates are increasing. So, it's really important to know that, because your assumption may be that they're not drinking or they're not using, but in reality, some of their issues could be a result of substance use. Nearly 1 million adults aged 65 or older live with a substance use disorder. That's a lot of people that we're working with. Also, they're more likely to take prescription medications because of aging. And are they being prescribed a medication that could cause an addiction, such as, are they on pain medications? Are they on benzodiazepines, where the body, builds a tolerance, they need more and more, and maybe they don't even know about this. Also, the admissions into treatment of older adults has increased into drug and alcohol treatment from 3.4 to 7%. So, these are all indicators that substance use is on the rise with our older adults. Another substance use risk factor is the combination of medications with either non-prescription drugs or dietary supplements. One dietary supplement, kratom, is sold as a health remedy, but it is abusable. In low doses, it could cause like a cocaine high. In high doses, it could cause an opiate high, but people don't know that. It's being sold as a supplement. So being careful what our older adults are mixing their medications is really important. Also, the misuse of prescription drugs, which could worsen existing mental health issues. What are they, are they taking medications as prescribed? Also, forgetting to take their medication, taking it too often or not enough. I know sometimes they don't want to take the medication as prescribed, so they might skip a day. Well, if they're skipping their mental health medication, just taking it when they feel like it, really doesn't work that well. So those are things, education is really important for our older adults. Another thing to understand is older adults metabolize substances more slowly, and their brains can be more sensitive to drugs. It is often absorbed and break down, drugs and alcohol not as easily as before. So they might have been able to have a drink now, but now that one drink may affect them very differently, or taking a pill. So that's important for them to understand the education. Also, the impaired judgment coordination, either because of a physical health issue or because of a substance use, can cause accidents such as falls and motor vehicle crashes and all that. So when you're working with older adults and you see that they've been falling, yes, it could be a physical health issue, but it is important as well to understand, to kind of get a feel. Are they using their medication? Are they taking it with substances, whether it be alcohol, marijuana, prescription pills, cocaine, anything? It's important to really, see the physical health indicators and then follow up with that.
Hannah, this is Mandy. I'm sorry. Sorry to interrupt. The previous slide, before you would move too far, you mentioned the name of a dietary supplement. Could you reference that again?
Sure. It's called Kratom. It's Kratom. So it is a substance on the rise that's sold at like GNC, the tobacco smoke shops, and it's supposed to, it's sold to as either pain relief or I'm not really sure. I think it's pain relief usually. But what happens with kratom, it's undetectable by urine drug screen. So even if you give a urine drug screen, they may be you might be something different, and you give them a urine drug screen, it's not going to show up. It has to be a specific kratom test to show up on a UDS. And taken in low doses, I think it's like under 5 milligrams, it gives you a person like a cocaine high, and over 5 milligrams gives them an opiate high. It is not regulated by the FDA, and each person metabolizes different. So if they're using kratom with alcohol or another opiate, it could cause overdose. So that's something that is not as known. But if anybody has any other questions, please just let me know. But yeah, so that's something to be. So if you're doing home visits, it's important to see what is on their dresser. Ask them, can you show me all your supplements? Can you show me all your medications? So that way you kind of keep an eye of what's going on and document them. Write them out. Anybody else before I move on to substances?
That's the only question that was posed. Dawn mentions that kratom is now on the DEA watch list.
It is. A few years ago, I feel like it was like 2017, they tried to make it a controlled substance, but it did not pass. So kratom is illegal in some states, but in Pennsylvania it is legal. And like I said, you could walk into like a tobacco shop and buy kratom. So it's really easily accessible, and on the internet and all that. All right. So right now, alcohol is the leading substance that older adults are using. This survey was from 2008, but 40% of adults aged 65 and older are drinking alcohol. And the thing with alcohol in older adults, they have an increased sensitivity to it. As they get older, they have a lower tolerance. So, maybe it just took them 3 drinks to be happy, but now they're drinking, 6 drinks, and they're not aware of it, Also experiencing the effects of alcohol more quickly than when they were younger. So if they have, if they're lifelong drinkers, let's say, I always had a couple of drinks before going to bed, but now I find that, it's causing more issues, but they're not relating it to the alcohol use. So again, understanding, tell me about your day. How do you get up? What do you drink? What's your bedtime routine? Is really important so that you're not asking them directly, hey, are you drinking alcohol? And they're going to be like scared and say no. But if you kind of go around just talk about your day, talk about how you cope and stuff like that, it may be helpful too. And then you take the opportunity to educate them, like, alcohol is going to affect you a little bit differently. You're on all these medications. Let's see how these medications and alcohol, how it's affecting one another. You're talking about pain, but you're drinking with the pain medication, so it's not working as well. So all these things are opportunities for you to kind of intervene and do some education and support. Again, 65% of people 65 or older are reporting high-risk drinking. And a tenth of adults 65 and older are identifying binge drinking, which is drinking 5 or more drinks on the same occasion, and 4 or more for women. In 2020, it shows that the increase in alcohol in recent years have been greater for people aged 50 and older. So definitely, older people that's one of the highest growing population for alcohol use. So when you're talking about alcohol use, you're not just talking about, vodka and rum and all that, looking at, again, that's why it's important to understand, what's in their medicine cabinet, what's around them. So you're talking about mouthwash, cough syrup, Dayquil, hand sanitizer, extract. Extract has a high alcohol content. And so a quick story. So this has to do with a younger person, but how it could affect older people as well. So this mom, she started missing her vanilla extract. And the first couple of times, she just assumed she was using it or somebody else was using it for cooking. But then she found like the extract bottle like behind a sofa or something, and it just didn't click for her. Like, why is my vanilla behind the sofa? So as she continued to do some investigation, she realized that her son was drinking extract to get drunk. So, looking at what's on the grocery list. Why do you have so many vanilla extract bottles here? The rubbing alcohol. I mean, there's so much here, but this, like I said, you'll be getting these the PowerPoint presentation, but especially now with COVID, where people aren't going out as much. What are they drinking, and how healthy are they? Are any of these things to take? Also, again, many prescriptions over-the-counter medications as herbal remedies can be dangerous or even deadly when mixed with alcohol. Medications that interact badly with alcohol include aspirin, acetaminophen. So if someone's taking aspirin for a heart attack, educating them on that. Cold and allergy medicines, like if they're taking Dayquil and, alcohol, drinking alcohol. Cough syrups, sleeping pills, are they on Ambien? So Ambien or benzo with alcohol, again, could cause respiratory depression. Their pain medication, again, like what kind of pain medication are they on? Anxiety or depression medication, again, teaching them. It's about education. Say, okay, yeah, you can't really, they kind of cancel each other out. Like if you're drinking a couple beers and you're taking Prozac, it's not going to work. They're canceling each other out. So having them understand that. The other thing that I wanted to mention quickly, which I did not put in this PowerPoint presentation, is some of the mental health medications that are being prescribed are also being abused. So Neurontin, also known as gabapentin, is a medication that is being abused, taken in high dosage, is an opiate-like effect. Wellbutrin, snorted, it'll give you like a cocaine high, and Seroquel is also being abused. So learning about the mental health medication that the individual is on is also helpful, and making sure they're taking them as prescribed. It's important to do some education, because people might think, okay, this 1 or 2 drinks at night is not going to affect me, but if I'm an older individual with physical health issues, who may already have issues with my liver or kidneys, it's important to teach them how alcohol could negatively affect these different body parts, because they may not realize the physical effects of alcohol. So it'd be important to share that with them. So when thinking, alcohol is legal, it's, it's something that people used as a social event. So really, again, educating adults, age 65 or older who are healthy and do not take medication should not have more than 3 drinks on a given day, 7 drinks a week. And then drinking more of these can put people at a serious alcohol problem. So when you're working with your population, with the older adults, again, finding out what is, how many drinks do they have? How, what are their physical health issues? What are their medications? These are all important things to work with when you're working with your older adults. Alcohol is addictive. So you build a tolerance for it. So your body wants more and more and more. So again, education, talking to them. Also being vigilant. What are you seeing, with someone when you're meeting with them face to face? And again, COVID, what are you doing? Doing more telehealth. So you may not see that interaction. Oop, I just did my hands. You may not see what's going on with them because you're doing it video. But if you have the opportunity to see the person face to face, that's really important because, are they exhibiting any of these symptoms? Anxiety, shaking hands, headache, nausea, vomiting, insomnia, sweating. Now, these are all symptoms that could be related to a physical health issue, or it could be symptoms related to depression or anxiety. But then asking them, do any of these symptoms get better? And how do they get better? If they say, well, I sit down, I relax, I have a drink, it could be that they're addicted to alcohol and unaware of it. Now, alcohol, okay.
This is Mandy again. Another question from the audience as we're still in the alcohol conversation. Is there a difference between spirits versus wine, or is alcohol the same no matter what?
Good question, because I don't know the alcohol content in spirits, but regardless, I think it all depends on how the person metabolizes alcohol. So, of course, your 151 proof is going to be way worse than somebody, that's something that has a lower proof of alcohol. But it all depends on the individual's, their physical health, how they metabolize it, on their own different medications. Do they already have damage to, their liver and kidney? So I think first it is individualized, but I do not know what the alcohol content, the difference is. But I think the effect is still the same because the person may have different physical health issues.
Thank you, Anna.
Did that help? Okay. When you're dealing with alcohol withdrawal, it is life-threatening. So somebody could die from alcohol withdrawal. There are, I think it's 3 substances, might be 4 substances that people could die from withdrawal. I think it's 3. It's alcohol, benzodiazepines, so any kind of Xanax, Ativan, Klonopin, and barbiturates like Senecal, phenobarb. The barbiturates are not as commonly used or abused. But alcohol and benzo is a life-threatening withdrawal. So if you're working with somebody who is either prescribed an opiate, prescribed a benzo or is drinking, and all of a sudden they stop, they could die from that. So that's why it's really important for you to know their history and make sure they're connected to the appropriate services. So a hallucination could occur from 12 to 24 hours from the last drink. Again, what else can cause a hallucination? It could be hallucination come from diabetes. Can't think of the word, but like a diabetic shock. Could be caused by psychosis. Are there mental health? What is their mental health diagnosis, and have they been maintaining their medication? Any kind of brain injury. So these are things that just to be aware of, that some of these symptoms can be something else, but if they're happening, it's really important to get them connected to services. Seizures can occur within the first 2 days after you stop. So a seizure may not happen the first day, but it's important for them to know that a seizure could occur. Your DTs, the deliriums, could start between 48 and 72 hours. So hallucinations, confusion, raising heart, high blood pressure, fever, heavy sweating. So these are all symptoms of anything. But if they go through it often, or they've had experience before, again, and finding out what they do to help is so integral to getting them connected to services. Hold medicines are abusable as well. So many times you have to show your license in order to get a medication. I know one store I have to show my license to get vanilla extract. So these are all could be abusable. So whenever you have to buy something over the, on the other side of the counter, many times it has the I'm not a scientist, so it's dextromethorphan, something like that. But it is abusable, and it's also used to make methamphetamine. So just something as an FYI. But maybe individuals could be prescribed this and they don't realize, they're drinking plus taking the cough medicine, or could be combining with their physical health medications. Marijuana, I could tell you right now, the marijuana of today is way different than the marijuana of yesterday. The marijuana from back in the day, the potency could have been, I think was like 3 or 4%. Now it's up to like 60%. Because the way the marijuana is being grown and processed. So if you have an older adult who back in the day, they smoked marijuana, it was no big deal. But now they may be feeling more pain and anxiety, and they're saying, okay, well, marijuana is natural herb, I could smoke it, but since the content is so high, it causes more physical health issues. And I could tell you, I know they say marijuana is not addictive, but if you ever know anybody who smokes marijuana every day, often, you tell them not to smoke, they're going to be going through depression and anxiety. So understanding that, impaired memory. So these are things just to be aware of. Marijuana can also interact with different prescription medications. So finding out, are they smoking herb? Is just kind of getting the feel like what's going on. The increase of medical marijuana being prescribed is also a challenge for the older adults. It is something that's on the increase. Does medical marijuana work? Yes, it does for many people. So that's something that would be important for you to know as a caregiver, as somebody who works with older adults. One of the challenges that is being presented now with medical marijuana is that it's not legalized federally. So anyone who is receiving federal dollars, such as Medicare, medical assistance, or county funding, and they have a medical marijuana card for behavioral health issues or substance use issues, they cannot be funded for treatment. So that is something really important. This is just like a side note as well. It deals with older adults, but also deals with anybody that you're providing any kind of treatment or services for. If the medical marijuana is being prescribed for a substance use or mental health behavior issue, they cannot receive federal funding. So affecting Medicare, Magellan, and county funding. Opiates. Now, we know about the opiate crisis, how it's affected. Just on a side note, fentanyl is high in Philadelphia, so many people are getting their drugs from their heroin from Philadelphia. And when they get a drug test, it's not showing up. So people are like, I'm injecting drugs, and they're thinking it's heroin, but in fact they're using fentanyl. And fentanyl is a much stronger drug, and it lasts longer in the system. So they may need a detox for more than just 5, it might need more of a detox for 7 days. Now with opiates, I think our prescribers are more aware of the addictive characteristics of opiates and how bad it is, but it's still being prescribed. And our older adults may not realize they're taking an opiate, may just take it because that's what the doctor prescribed. My mother's a big one, well, the doctor prescribed it, so it must be okay. And trying to teach them, like, no, it's not okay. Let's see how it affects your other drugs. Or, do they have an allergy to codeine? Well, if they're going to have an allergy to codeine, many times they have an allergy to other opiates, and knowing that. So there's the different kind of opiates and the pain medications that could be prescribed, and really important, and now there's a new drug called ISO, which is more of a synthetic fentanyl, which is stronger. So there's constantly things that are coming out to, for lack of a better word, like improve a person's high, but it is also more fatal. And you may not think of older adults abusing opiates, but they do. They may not be injecting heroin, but they could be injecting a abusing their pills and not even be aware of it. They just know it makes them feel better. So again, the brain is going back to, this makes me feel better, I'm going to take it again. Your benzodiazepines are a big one. So especially now during COVID, you have older adults who are more anxious and depressed and home and isolated, and they're doing a telehealth appointment and the doctor is not maybe as engaging with the person, or the older adult is not sharing as much, so they're going to give them, a prescription, and possibly it could be a benzo. So again, education, finding out what their meds are, because it is highly addictive. It keeps on increasing. If you see from of people 65 to 80 who use benzos, 31.4 receive prescriptions for long time use versus younger people using it for being prescribed for a lower length of time. So if if the doctor is prescribing a 30-day supply versus a 7-day supply with refills, these are things that not only does the older adult need to know, the caregiver or the person you're working, you as either a case manager or probation officer or whomever, whatever your role is, and education as family as well. What is the family role? Do you have a support person that you are in contact with for this individual so that you could discuss pain, med management? And again, benzo withdrawal is life-threatening. They could die from a benzo withdrawal. Educating, if you have a client who is on long-term benzos and all of a sudden they stop, educating, let them know it is life-threatening. Any questions before I go on to my next slide? All right, good. So when you're talking about misuse versus abuse, misuse can happen often with older adults. So they're prescribed long-term and multiple prescriptions, and if the prescription changes, from one session to the other, and I could tell you from my own personal experience with my mom, like, oh, your high blood pressure is not working anymore, we're going to try this one, but she's on automatic renewal at the pharmacy, so she just automatically gets her prescription. So now she's got a slew of medications, and we're not sure what. So one thing that is really important that would be a skill would be having a list of medications that's written out, so that the older adult can have with them, and you have it in their chart, and maybe it could be posted somewhere. So if you're doing a home visit, say, okay, let's review your list of medications. Depending on your role, are you able to count their medications? How many pills are left, to see if they're taking them as prescribed? Are they abusing? Also seeing, are they addictive medication, and are they taking more than prescribed? Yep.
I'm sorry, I thought you were taking a pause.
I don't mind.
Christy asked, what is a non-addictive alternative to treat anxiety?
So you have Paxil, you have Celexa. There's a few new ones, and off the top of my head, I can't think of them. But, if most doctors won't prescribe Xanax, most psychiatrists will look at alternatives before they're going to prescribe a benzo. So looking at like the Paxil, Celexa, threw me off here. I'm trying to think of there's a new one, and I can't remember the new one, where there's alternatives for non-narcotics. They may not work as well because a benzo will give you immediate release, whereas these non-narcotic medication, they kind of build in your system. So again, if your brain is looking for immediate gratification, for immediate relief of symptoms, they're going to go to what you worked before. So if somebody has been using narcotics for immediate relief of anxiety and depression and all that, more of anxiety, and now they're being prescribed a non-narcotic, they're going to say it's not working because it doesn't give me the relief like a Xanax does, because it's longer lasting. You have to kind of build it up, and it can take anywhere from 4 to 6 weeks for the medication to work. So when you're talking somebody who has a substance use disorder or substance use history, they're looking for that immediate relief. I hope that helped. Also, cognitive decline will cause improper use of meds. So, is somebody going through some kind of cognitive issue? Are they newly diagnosed with dementia or Alzheimer's? Are you seeing some things in them when you're working with them? Using over-the-counter medications with other medications. A big one, using of other person's prescription drugs. This is misuse. So teaching, individuals that just because one medication worked for somebody else's issue, it may not work for you. And again, I'm glad my mom doesn't live with me because she'd be like, stop talking about me. But she's a big one, like, oh, I had stomach pain. This one was prescribed this, it worked. This is what I want. I'm like, Mom, but you're on all these other medications. So teaching individuals about the using of other people's prescription medication is important. Taking medications, taking more than prescribed or prescriptions that are expired. So if you're someone who is on a budget and you have to pay for your medications and all of a sudden you have a medication that's expired, you might continue taking it because you don't want to waste the money. So teaching them, the importance of just taking them as prescribed and making sure they're not expired. And later on in this session, I'll talk a little bit about how to get rid of those old medications. You have to be aware, are they taking medications for the euphoric feeling or avoiding to get sick? That's when you're starting to look at substance abuse. You're intentionally looking for a medication to make you feel better and taking more and more and more because now you're building that tolerance for it. Like if they're seeking a higher dosage, if they're saying, oh, I lost my prescription or my pills fell or somebody took my medications, it may have happened, but if it continues happening during your visits and you're hearing more and more, or you counted their pills and a 30-day supply, they only have 10 pills left, these are indications of a substance use issue. And so a higher intervention may be needed. For somebody who's addicted to a substance, it's hard to control their use. So, asking them, yeah, you had one or two drinks. Have you ever had more than one or two, and how often, or how long does a bottle last you, a bottle of alcohol, or, the prescription medications, or is there anything else that you're using to make you feel better? These are all questions that might, again, if you ask somebody directly, are you using drugs? They may be like, no, get angry. You're trying to build that rapport. So you're just trying to get an idea of what it is that's helping them feel better. Although also alcohol and other use can mimic the mental health or medical, diabetes, depression, or just the facts of old age. So it may be their substance use may be hidden by assigning their symptoms to another illness or just writing it off as old age. Again, family, friends, including your family supports, are they seeing something different? Because they might stop using because they know they're going to get a urine drug screen if they're on probation, or they know that the caseworker is going to come over or the case manager is going to come over, so let me hide my alcohol or let me not drink so they can't smell it in my breath or anything like that. But that's why it's important to include their sober support system. Like their daughter might, or son, or husband, or wife may have a concern and may not know who to reach out. So also contacting their doctor, if at all possible, or ensuring that all the medications that you're taking. It's really important. The primary care doctors, their physicians are really play a key role in their screening. So not writing off like, oh, this is like the third time you fall, might be something with your hip, but also finding out some of the history. What can be causing the falls? What can be causing these abrasions on your leg or your black eye? Anything to kind of might be an indicator of something else. Again, thinking about older adults, they're more likely to drink or use drugs at home rather than public. So are they hiding their liquor? One of the challenges in screening is some of our screening tools will ask, to give an indication of how it's affecting their work life or their school life, but somebody who's retired living at home, who's not having a very active life, especially now with COVID, some of these screening questions may not really pertain to them. So if, the challenge, not being able to catch something. Again, symptoms might be depression, might be dementia. So doing an overall, looking at the whole person, what's going on with their ADLs? Are they showering? Are they eating? What are their entertainment, things that you want to look at everything that they're doing. Caregivers may be aware, but they don't want to talk about it. Very often, there may be some fear in addressing it with a family member. So if I would have to tell my mom, listen, you can't drink anymore, that would be very uncomfortable, and I don't know if I could do it. So again, if there's some kind of connection between the caregiver and the professional, and together may be able to address a challenge that the individual may have, education is really important, like including the doctor. There are all these sort of different ways of communicating with people if they're aware of a problem. So it is difficult, but there's peer-to-peer work that might be available as well. Again, the lack of awareness of the prevalence, so the caregiver may not know about how prevalent it is, or the physician or you as professionals. You're like, hopefully by the end of this training, it'll kind of help you be in tune a little bit more with your older population. Say, oh, I didn't even think about them drinking. Oh, I didn't think about them abusing their medications. What can I do differently when I approach them, when I talk to them? Again, using open-ended questions and just asking, how questions. Again, there is this recognizing the symptoms. What can the symptoms be? Talked a bit about the assessment and limited treatment options. So one of the challenges with treatment is most of our treatment is geared towards group settings, right? So you may have an older adult who's abusing alcohol or opiates or anything, but their life circumstances might be different than somebody who is 20 who's abusing substances, so sometimes it's difficult for them to identify and connect with a peer. I know Penn Foundation has a program that's geared towards individuals who abuse alcohol. Some of the recovery houses have a little niche for older adults. So these are things working with the providers to identify a need and say, okay, how can we connect this person to the need to the service? It's a challenge. It really is for older adults. Hopefully many of you are trained in stages of change and how to ask questions, really open-ended questions. And some examples like, how do you spend your day? What are some of the things that you do to cope with the loneliness? What makes you feel better? Learning about their past. Is it somebody who's been in recovery for 15, 20 years, 30 years, but now doesn't have access to their sober support system? Most of the meetings, if they had home network or they had specific meetings and a sponsor, and now that's gone because of COVID. So everything's virtual, and if they can't access technology or don't know how, you may be an integral part in teaching them how to access Zoom meetings, right? So, the 12-step community has Zoom meetings. NAMI, the National Alliance for Mental Illness, has Zoom meetings. So teaching them how to access those meetings so they don't feel so isolated, connect, even if it's virtually, is really important. Looking at support meetings for the individual, but also for the family members. Many times families don't know about recovery or how to help their older adult. So having them attend like Al-Anon, and some of these adults could be adult children of alcoholic parents. So, what does it stir in for the caregiver? So getting them connected to Al-Anon or Alcoholics Anonymous, Al-Anon or Al-Anon if it's an adolescent, doing smart recovery. Bucks County also has a program called Be Care's Family Connect, and I'll give you that information in a little bit. Looking at what kind of medical interventions needed for these individuals. So again, do they need withdrawal because they are taking too much of a drug or alcohol? Many times they don't want to go inpatient. Inpatient is scary. They're set in their ways. So working with a primary care doctor, is there a way to help do like an outpatient detox for them? Many times individuals who need going through withdrawal, they may get a benzodiazepine taper. So instead of drinking the alcohol, they'll try to wean them off with a benzo, but then being aware of what that benzo is doing to them. But really working closely with a PCP or a psychiatrist to see what are the options out there. Again, learning about treatment, educating them that treatment's not always about residential treatment. How about outpatient treatment? Maybe doing a group, general outpatient, intensive outpatient, even partial if it's a Monday through Friday kind of program where they're able to stay at home, but they get back and forth to treatment. Because many times, it's the fear that will be the challenge in accessing care. Like, I'm afraid to go inpatient. I'm afraid I'm going to lose my housing. I'm afraid that my family's going to find out. So working with those fears is really important to get somebody into recovery. Again, teaching the older adult, okay, how does it process, and the caregiver as well. What are the medications being prescribed? If you see or you hear, if you're looking at the bottles or you hear about them doctor shopping or pharmacy shopping, they're, you're going to primary care for this, you're going to physical, another doctor for this, psychiatrist for this, but then you're going to this doctor. You have all these multiple prescriptions. So many times it'd be helpful to get a list of their medications and keeping track of their doctors or having them. It's really important. Having a list, where are you getting them from? What are you getting them for? And what are you getting them? How often do you have to go? When's your next prescription? And things like that. Just having a log for them. Having those prescription, like that little Sunday, Monday, Tuesday, Wednesday thing, so that they could flip and know when to take their medications, especially when they have so many. Getting connected to a pharmacy, saying, okay, can you cancel this prescription because that person's no longer on that prescription is helpful. Again, if abuse is suspected, don't ignore them. Don't ignore it. Don't try not to talk about it. You're really trying to engage them in a different level. It doesn't help when you talk at them. It really is engaging them in a way that you could talk with them is important. What are some of the things to look for? Are people being secretive? If there's a change in sleep habits, unexplained bruises? Is there a way of the doctor shopping? Are there more pill bottles than usual? Or they're using a lot of excuses about, I dropped my pain, I dropped my medication. Any kind of changes in mobility, increased conflict, just lots of things that you think about when somebody is abusing. Many times they're very secretive, or they failing to bathe or keep clean, change in eating habits. This all could be indicative of something else as well. It could be something that's going on with their physical health. It could be something going on with their mental health. It could be something with, COVID related because of everything that's going on. Maybe they're not a depressed person, but all of a sudden they're feeling their depression and they don't want to talk about it. So these are just kind of warning signs for you to be more aware and maybe have a different kind of conversation with the person that you're working with or the person that you're living with. Also, what are some of the physical, they're getting nosebleeds a lot, or a runny nose that's not caused by an allergy? Are they snorting in any kind of medication? Are they snorting cocaine? Frequent sickness, or are they going through withdrawal, sore spots? Huffing is another thing. Like, are they, one thing to kind of be aware of is like huffing spray paint, or huffing PAM, anything that has like aerosol. Unexplained seizures, headaches, vomiting, or they have a dry mouth. And the dry mouth can be caused from the medication they're on. So weight loss, all these things are important to recognize and just kind of give you a warning sign. Are there any questions before I go into Bucks County resources? All right, I'm entering Bucks County resources then. Here we go. The number one resource I feel, not to toot our horn, but we do have a website. It's bcdac.org. And everything that we talk about, you have access to on there. All the resources, the recovery houses, treatment providers, our contact information. You could even email us if, and sharing this information with a caregiver, saying, if you have some concerns and you just want more education, please reach out to this agency. We really are here to help. So any information, and it's anonymous, and sometimes people don't really want to deal with the phone or anything like that and feel better through email. So the first step in accessing treatment is an assessment. An assessment's about a 2-hour session face-to-face. Right now, most of our assessments are occurring through telehealth. Again, in a way, there's some benefit because you could do it directly from your house. You don't necessarily have to go to somewhere, and you know how transportation works in Bucks County, like public transportation sucks. But again, there's that missing piece, like not being able to really pick up on some of the different nuances in working with somebody face to face. So, you know, but just to educate the person, this is what's going to happen with a telehealth appointment. And it's usually with an assessor that's in their insurance carrier. So it's important to understand, do they have private insurance? If they do have private insurance, in the back of the card, there's a 1-800 number usually that says for mental health, substance use, or behavioral health issues. And once you contact that number, it'll give you a list of contracted providers, and that way it won't be out of a pocket cost as much. If somebody has Medicare is one of the most difficult insurance to cover drug and alcohol. The good news is, since January of 2020, Medicare is willing to cover methadone maintenance for individuals. In the past, Medicare never covered methadone maintenance, so that's one thing. If a person has Medicare and they need drug and alcohol treatment, unfortunately, if they need inpatient treatment, they need to meet a hospital level care. So that means that they need to go into either Eagleville or Valley Forge Hospital, who could address their medical needs plus their drug and alcohol needs. The challenge is what happens if the person doesn't have medical needs that are severe, that's affecting their substance use. So they don't have like the high blood pressure or the cirrhosis or any of those indicators of physical health needs to meet that criteria. What the Drug and Alcohol Commission has done, we have paid for assessments for individuals to see where they need to go. You know, unfortunately, our money county funding is for individuals with no insurance, but in case by case, like somebody's a priority population, if somebody is an injection drug user, somebody who's an overdose survivor, a woman who's pregnant, and a veteran, they're all considered priority population. So if you're working with somebody who has Medicare and you're trying to access treatment, you know, they may qualify for county funding. Your best bet is to contact our agency to say, I have this person, how can I connect them to services? If they're looking for outpatient services, they need to go to Family Services, Penn Foundation, or Pendel. Those are all places that accept Medicare. Aldi is now in the Medicare network, so Aldi would be another place for treatment.
Anna, there was a question that asks, does this change if they are dually diagnosed?
What if they have Medicare and they're co-occurring? Is that the question?
Karen, do you want to, in other words, if Medicare is primary?
So if Medicare is primary, regardless if they're co-occurring or not, they would have to go to a provider that accepts Medicare. So if somebody who's co-occurring, if they're looking for outpatient treatment, they would have to go to either Family Services, Penn Foundation, Pendel. Aldi does do co-occurring treatment as well. And for inpatient treatment, unfortunately, it's only Valley Forge and Eagleville, unless they fall under the priority population. Does that help any? I don't know if I answered, I think it was Karen's question.
Yes, she said yes.
Okay, good. Getting nervous.
A test. Thank you, Anna.
It's hard not to see people, so I'm like, did I answer your question? All right, so medical assistance, Magellan, and no insurance. If somebody has medical assistance, Magellan, or no insurance, then they go within our provider network at our base service units. So when you're looking at where to send somebody, so if somebody is in from Lower Bucks, Pyramid and Gadenzia at this time are our assessment sites. Pyramid is doing telehealth only. So this is the contact information. Gadenzia does do walk-ins, so they're doing face-to-face. They could do telehealth, but doing walk-ins. The other thing with Gadenzia, it's a 24/7 assessment site. So they are available all day, every night, the weekends. So if anybody is in crisis or regardless of where you are from the county, you can go to Gadenzia as a walk-in. Again, it's first come, first serve, so there might be a little bit of a wait, just like any health clinic, but they are available 24/7. Then you have Aldi in Doylestown. Aldi Langhorne is no longer an assessment site. They have treatment, they do treatment and methadone maintenance, Suboxone maintenance, all that, but they're not an assessing site. So in order to access treatment, going to Aldi in Doylestown, they're doing both walk-in and telehealth appointments. And then SOAR Corporation in Warminster are doing walk-in and telehealth appointments. And then we have Penn Foundation up in Sellersville that does walk-in and telehealth appointments. They ask that you call first for an intake, just so that they could screen you. What are some of the supportive services that are available in Bucks County? We have B-Cares, it's Bucks County Assess, Refer, Engage, and Support. So there, the B-Cares is available through I think there's 7 hospitals in Bucks County. So anybody who goes to the hospital emergency room for anything that's substance use related, or they're placed on a medical bed because, let's say they had a heart attack, but they have a history of alcohol abuse or on, opiates or anything like that. An assessor, certified recovery specialist that's assigned to the hospital. So let's say it's a Penn Foundation. Someone goes to St. Luke's. So Penn Foundation, B-Cares assessor will go to the hospital, assess them while they're in the hospital, and try to engage them in a bed in treatment from the hospital. So it's like a door-to-door service. The Drug and Alcohol Commission will pay for the first 3 days of treatment, regardless of where the person is, to ensure bed-to-bed admission. And then once the person's admitted into the hospital, then, they'll do the assessment and getting that person, the appropriate coverage. So this is available in all the hospitals of Bucks County. Then we have Bucks County Family Connect. This is a great program, and I use it often. I connect families. Somebody doesn't have their mute on. It's giving me a little noise here, and I'm easily distracted. So B-Cares Family Connect is a family peer-to-peer. So let's say you're working with an older adult who's really resistant to any kind of stopping use or is not aware of it, and the family has tried and they don't know what to do. You could connect them to the B-Cares Family Connect. They could easily email B-Cares Family Connect at gmail.com, and somebody will contact them. It's anonymous. Well, it's not anonymous because they have their names, but it is free of charge, and it's just a mom, a dad, a parent who has been through that experience and just outreach to that individual to give them support. I may refer a lot of family members to that, especially our community phone calls. Like, I don't know what to do with my son or my daughter. So it's a great program, and I hope you do utilize that program. We have different case management in Bucks County. We have intensive case managers. We have task case managers. We have moms case managers for pregnant women. We also have, through the recovery centers, we have certified recovery specialists. So there is a lot of support out there that individuals are eligible. And the difference between drug and alcohol case management, and let's say mental health case management, drug and alcohol is open to anybody. Like, you just need to send a referral. I know if you have experience with mental health case management, sometimes with the mental health case management, there's more of a process, and you have to get a psych eval and things like that. So it's just easier to access. Penn Foundation has mobile engagement services and is a center of excellence. So they have case managers with mobile engagement. They have case managers that will come out to the community, to the house, to try to engage the individual and the family into treatment. So if you are dealing with a challenging case, mobile engagement or the Center of Excellence case manager would be good choices to work with that individual. So they're in the contemplative stage of change, so they're not really sure they want to go to treatment or they have a problem. These are good modalities to help with that individual. Family Services also does Center of Excellence. So Family Services has more of the lower part of the county. Talk a little bit about recovery houses. Bucks County has a recovery house association where it's a voluntary association where recovery house owners are part of it, and in turn, they will get referrals from the county and from the jail and all that, probation, In return, they have to agree to abide by the rules and regulations and have a complaint and grievance process. It's been an association that's been in the county for over 22 years. So if somebody needs to access the website, I've included the website. Obviously, I've included the website twice. But it'll give you a list of recovery houses that are male and female and how to access the services. The good thing is Bucks County can help out with funding for recovery houses. So the Drug and Alcohol Commission can offer somebody who's being county funded in treatment 2 weeks of recovery house funding. The person does have to be in treatment. So if somebody's stepping down from inpatient to go to outpatient and they need recovery house funding, they need to make sure they're engaged in outpatient treatment. And then there's another program called BC Rock. Bucks County Recovery House Oversight Committee. There is a scholarship that can last from 30 to 60 days for individuals who have Magellan, who need to step down to recovery houses. So with county-funded recovery house, we only work with like 4 recovery houses. But BC Rock has a larger provider network. So again, any questions about these services, you could contact our agency and we will be more than happy to connect you with anything that's available. We have drop-in centers through Bucks County. Now because of COVID, some of this stuff is happening telehealth, but the largest drop-in center, which I believe may still be open, is the Southern Bucks Recovery Center. They're located right there on Veterans Highway, right where the Bucks County Community Colleges, Taco Bell, Nirvana, and then on the other side is ProAct and the Southern Bucks Recovery Center. They will connect the person to a recovery coach, a certified recovery specialist. They have a bunch of workshops that are occurring through Zoom. So if somebody needs to engage in some kind of structured activity during the day or evening, Southern Bucks Recovery Center does have a schedule of events. Then you have the Central Bucks Community Center, and then you have the Women's Recovery Community Center. The Women's Center is also a transitional house, recovery house for women who are either substance use or co-occurring. They have older adults that live there. It's structured. So again, any information that we could provide, just contact us.
Anna, there's a question.
Oh, yep, go ahead.
Michelle asked if there are any case managers who go into Central Bucks/Lower Bucks who are mobile and able to visit clients in recovery.
All the case managers are mobile. Now, if you're asking if they go into people's homes, they will not go into people's homes. You know what? I think Center of Excellence case managers may go into people's homes through family services in Lower Bucks. But the intense case managers that we have for drug and alcohol through PROACT work throughout the county. So they will meet the individual at a pre-described location. So let's say the individual, there's a McDonald's that's nearby. So the case manager can meet the individual at McDonald's or at the library or anything like that. I think because of COVID, many of the, again, sessions are happening telehealth. But I could find out if whomever is asking, if they want to send me an email, I will find out if they're occurring, when they're picking up face-to-face. But the intensive case managers are throughout county and they are mobile. They are not office-based. Was that helpful? Yes, no, maybe.
Thank you. And Michelle, I am reposting Anna's email right here at the bottom, so you don't have to scroll to the top. Thank you, Anna.
Great. Thank you. So we have our prescription take back October 24th. So if you are working with anybody or you have, if you're working with a caregiver, any prescription medications that are expired or that you need to get rid of, please do not flush them or throw them away. That's not environmentally sound. Please get rid of them through the prescription take backs. There are medication take backs in most of the police departments in their front, usually in the front center when you first open a door. Sometimes you don't have to go all the way to the police department. But there is like a mailbox. In Doylestown, there's one in the administrative building. There's one in the courthouse, I believe. But there is a prescription take back occurring October 24th, community-wide. So they're going to be collecting prescriptions. So if you go into our website, and it most likely will have the different sites that are available. This is just a listing of some of the self-help organizations that are available, through phone number if people are trying to get connected to some of the services. And lastly, I think there's some additional resources if you need to, you're interested in learning a little bit more about how to talk to adult patients, linking them with resources, just more of an educational for older adults. To see, if you need to learn or refer other people to some resources. And lastly, this is our contact information. We moved from Warminster to Doylestown. Right now, we are like rotating in the office. Some of us are in the office on certain days. We are still distributing Narcan. So if anybody's interested in Narcan, just call our office and we could try to connect you somehow. I think you have to go down to the first floor to collect it, but still give us a call. And that's about it. Open for any questions?
Anna, do you know if you will be giving permission for your PowerPoint presentation to be shared on the college's web pages?
Yeah, if anybody needs it, I could email it to people or, yeah.
So if you are a participant who does not want to wait for it to be made available on the web page in the future, you could email Anna at her email address, or the organizers of the conference will make all available PowerPoints accessible in the following week or two.
Yeah, I mean,
Sarah will be contacting you.
The info is out there. Anybody could have it. Just make sure you give me credit if you're going to use it for your own training.
So if you have any questions, you can type them into the chat for Anna.
No questions? There's always questions. See, this is what happens when you do it virtually. You need face-to-face interaction.
We had a good couple of questions throughout, too. Let's give that awkward silence a chance.
Hey, I'm a therapist. I could stay here all day.